Black Doctors Podcast.
Hello, welcome back to the Black Doctors Podcast. I am Stephen, your host. Today, I have a very special guest, Dr. Elisha Peterson. She is a triple threat, triple board certified anesthesiologist and does so many incredible things. She does host her own podcast, the Sevo Sisters. Sevoflurane, if you don't know, is an anesthetic gas that we use. So very on brand. But Dr. Peterson was kind enough to host me on her show, and she is kindly returning the favor. So Dr. Peterson, thank you so much for joining us.
Oh, I'm so thrilled to be here. I mean, Stephen, this has been like a long time coming, but I love all the things that you're doing as well. So thanks for having me on. And I am very happy to just sort of get right into it. I
love the collaboration. I mean, there's not a lot of us in these spaces.
You're absolutely right. And we need to be, because there's been so much going on with Blacks in medicine, and there's just, we have to be more vocal, and we have to be just as brazen and honest as we can be, because people out there literally are dying, whether they're killing themselves or metaphorically or literally.
In the past, it seemed like melodramatic, like, oh, people are dying without us. But it's really true that you never know what interaction you're going to have with a patient or with a coworker, and just being somebody that they can relate to can actually save lives.
Yeah, it's serious.
Awesome. Well, Dr. Peterson, it's so awesome the things you've accomplished. Your training you're very subspecialized, and we'll definitely get to that and some of the other resources that you've created. But I want to start kind of at the very beginning and talk about your pathway into medicine. When did you first decide to become a...
Yeah, this is what I always tell medical students too, because so many of us, but Black and Browns, we're like, well, we don't have any doctors in our family, right? So they automatically feel at a disadvantage. But guess what? A lot of the patients we see, they don't come from a family of doctors either. So we're in prime position to actually relate medical information to patients. Neither one of my parents are in medicine at all. And none of my extended family is in medicine. My mom's an engineer. My dad got jobs for people who didn't have jobs. And he worked in a very commission-only, high-pressured kind of environment where he was the only Black male. So he always came home complaining about the racism he's faced. My mom, as an engineer, Black woman, she was in a white-dominated field herself. And she wasn't as vocal about her challenges, but man, oh man, she overworked. She didn't sleep, barely ate, all to prove that she is worthy. Yeah. Something that she's worthy from the beginning, right? Like, that's not something to prove, but just overworking. So I grew up a latchkey kid. Myself, my younger brother, we stayed at home, and I grew up literally like from the TV. Watching TV is how, like, I got my semblance of how reality should be.
Wow.
And I watched a lot of Cosby Show. That was one of the few shows where we had people that looked like us on TV. And what was Mr. Huxtable, or Dr. Huxtable? He was an OB-GYN, right? And his wife, a lawyer. And that was my exposure. I loved that he was his own boss. He worked out of the home. He was still very much involved with the family affairs. And he lived in that beautiful brownstone. And I'm like, looks like he got the life. And I want that. At one point, I did say I wanted to do law too, only because people, when they always ask kids, like, what is it you want to do? And when I, lawyer, it raised eyebrows, right? So I was like, oh, maybe that's it. But then I saw that it was a lot of paperwork and books. And I'm like, I want to be involved with people. I want to be one-on-one, direct, and really serve them in a way that helps them bear that vulnerability that you have whenever you are hurt or injured. I think my sensitivity and desire for that really also came from the fact that I grew up in a household that, one, it was just me and my brother at home, so we were raised on the TV. And then when my parents did come home, like, my mom was like asleep or trying to stay awake. And then my dad was angry. So those two had arguments all the time. One's sleep deprived and one's got all this angst. So I lived in a very contentious household at that. And I think that gave me a lot of great insight and sensitivity into traumas that people face day to day. And with having that insight, I wanted to step into that in a way that can help neutralize it, because it was really hard.
And that's fascinating because from the outside, you have two very successful, hardworking, caring parents. And it goes to show, like, you never know what's going on in people's homes. You have folks that are single parent households. And my mom stayed at home to raise us, and my dad worked and deployed for 6 months. So looking back, it's like, hats off to the parents that did the best they could. And we got to carry the torch from here.
You're absolutely right. I mean, they worked hard. And at that time, I think that era was all about making sure your kids had what you didn't have, right? Yeah. So had the home. We had like random stuff, like a grand piano and a grandfather clock and like a hot tub. Just these like random toys that nobody was even around to enjoy.
Yeah, did you have a waterbed?
Yes, we had a waterbed. How'd you know?
So y'all were rich.
Oh my gosh, that's so funny. And then they took away the waterbed, and then they got these like crazy ostentatious brass beds, like brass headboard and backboard that you can't even touch.
Because you get the fingerprints on it.
Equally, you cannot live like a big thing, or the oil from your hands. It was wild. So that was my backdrop. And in school, I did like biology. So here's another thing. My mom, despite all the struggles she had in engineering, she wanted me to be an engineer like her.
Really?
She wanted me to she got me involved in the summer camp at IIT in Chicago. And I realized, I'm like, I don't like this, right? It's a lot of math and physics, but I do like the underpinnings and understanding how the body works. So it translated from the inanimate to looking at the animate.
Yeah.
My dad had a lot of health challenges, and I began to become more involved and interested. First, it started off with high blood pressure. And then with high blood pressure, still not having great lifestyle habits. One of the coping mechanisms after work was going to happy hours and going to the bars. And so he developed congestive heart failure, and he would be admitted to get diuresed because he was getting all this pulmonary edema from the congestive heart failure. And so I found myself more interested and involved with what was going on with the body. So I went to public middle school, and then my parents wanted to put me in a private high school. And it was at that point where I was like, okay, well, so far I haven't been turned off by it, right? Everything else, it was like, I'm not really liking that.
Wow.
Yeah.
So then you went from high school, where'd you go to college?
Oh, I went to Loyola Chicago, where I majored in biology and psychology. Wow. And again, I think that really speaks to me wanting to position myself in a space where I can serve those that are very vulnerable. And so I double majored and triple minored in Black World Studies, Women's Studies, and neuroscience. And that was largely because Loyola makes you take so much core. It was like, well, let me be strategic about all this core I have to take. And that's how those minors came to be. But so from being a latchkey kid in high school and middle school, not being able to go anywhere and do anything, in college, I just went crazy. I joined all kinds of organizations. I had a little part-time job at the gym, and I always had a heart for kids. So I volunteered for the Chicago youth programs, and I was doing that every weekend. So over time, what's developing is I declared pre-med. I went down that path, but it's everybody, as soon as you declare pre-med, it's almost like you have a target on your back.
Yep.
Everybody is coming for you. It's just so competitive. It's disgusting. How much did you study? Did you look at this? Did you do that? People comparing grades, people comparing tests. It's a pressure cooker. So another reason for having the psychology and the other minors is because I could get away from the crazies, right? Because hanging around nothing but pre-meds is crazy. It's not healthy. You have to have something else. And for me, participating in the youth programs and having those other outlets was my something else. And I knew I didn't.
Yeah, I couldn't even imagine because these days you have pre-meds that are like on social media and they're like highlighting and detailing every part of their story. Whereas back in our day, yeah, we were secretive because we didn't want anybody to know because it was more competition. So I don't even know how they cope these days.
That's true. Yeah, exactly. You never wanted to look like you studied that hard. Yeah. Like back then you wanted to make it seem like it came natural. So you crammed. But yeah, now it's like everybody's so open with it. But yeah, so I think for me, throughout college, I knew based off of how crazy it was in school, I didn't want to go straight to medical school. I did not. Yeah. I was like, I want some real experience. I really want to beta test this. I want to see what's going on in the real world. Because in college, you get this false sense of security that you know what you're doing. When really, you're just a kid. You're just an adult. Like you're a kid, but you look like an adult. Right? You don't have any experience. You don't know what's going on. You don't know what people need. So the first year I did a research year at NIH.
Okay.
And at that time, everybody was, saying that research that's going to enhance your application. It makes it look like you're curious and you're innovative and that kind of thing. So I was there and it still felt like an extension of college, to be honest with you, because you're in this academic bubble in NIH and you're in your lab and you control all these conditions. My role was to look at polymorphisms in the DNA of women who have BRCA1/2 mutations. Okay. So it wasn't that stress test I needed because I wasn't, directly involved with people. Then I went to Ghana for a summer to do more research. Ooh, that was a bit more hands-on. It was in pathology. I was collecting brain and blood samples from children who died of cerebral malaria and severe malarial anemia. So these are mainly kids who were in the morgue and getting these samples from. Very heavy. And when you see the families whose child have died, and again, just being in that space with them, they were in the midst of so much pain. They were so gracious and was like, yes, whatever you need, I trust that this is going to benefit. This is going to help someone else. I mean, it's just touching. And then when I came back from that, I ended up teaching fourth graders for a year. And that was the real job. That was exactly what I needed to really inform whether or not I was ready to work with people in such an intimate way. Because teachers, baby, oh my gosh, you get it all. You're working with administrators, just like you would in a hospital. You've got the parents. Yeah. Again, I ended up working with kids, so I had the parents. Then you have the person you're directly serving, the child. And then you have the community pressures. And it's just on and on. It's multi-layered. So I cried every day for months.
Oh, no.
Prior to actually teaching. And that's not an uncommon experience. That's something that all first-year teachers go through, is having this crying in the back of the school experience because it's heavy and you realize how much of a need there is. And you see your own limitations. Like, you realize you're not enough. Like, you go from college thinking, I got this, I know this, I can study this up, to realizing, oh my gosh, I don't know anything and I need a lot of help. So what got me out of that was actually seeking mentors, master teachers within the elementary school space who really shepherded me and showed me this is how you run a classroom. And the way they taught me was brilliant because they said, run your classroom like the real world. In the real world, no one's telling you not to park your car there or don't eat that or you don't have enough money for that. You just face the consequences, right? You get the ticket or you start to feel sick. or you got negative in your account and the card declines. So when I started to shift my focus from wanting to micro what the kids did to providing a framework like the real world, it was a game changer. And what that fortified me was going into medical school. One, being a teacher taught me how to be a better student because it taught me how to develop frameworks for learning. Yeah. And I developed a sensitivity because during that year, I was teaching inner city kids in Southeast DC. I've had parents die. I've had patients who had severe traumatic events happen to them. And it's hard to get pulled aside from the principal and says that your child, your student went through this, and then have to hold it in and then go back in the classroom and smile and have all the energy and enthusiasm and teach a class. I mean, how often do we have to do that as physicians, right? In the next room, someone just died, someone coded, but yet now we have to go and start the next case, or we have to go and treat the next patient as if that never happened. I mean, we take a few minutes, but it's not enough. And yet we still have to learn how to shift our energy. And so it was a great, excellent training ground. And so for all those who are thinking about medicine, who have a previous career, I'm telling you, you got excellent transferable skills that for those who went straight through, you just don't have. And you can leverage those skills to the hilt. So then I went into medical school and I went to Rush in Chicago. And one thing I skipped over was that I knew I wanted to look at anesthesiology before I even saw a patient. And that was because when my dad was having his health challenges, and families, they don't tell you everything. They don't tell you every time somebody gets admitted to the hospital or go to the emergency room. But my mom managed to share with me that, yeah, your dad had to go to the cath lab. She kind of just brushed that part over and said, the doctor that took care of him, he said he's an anesthesiologist. And I thought he did such a great job with your father. You should look into it. You should look at that. I think that might be something you'd enjoy. So I came into it and was like, okay, I've never heard of that before, but I will look into it. So when I started medical school, I had that in the back of my mind to test that out, to explore that field. Wow. And when I got to Rush, it was every bit of crazy as undergraduate hanging around with pre-meds on steroids. I literally felt every day for those first 2 years that I was a gazelle in a jungle, for real. Yeah. And the lion was failure. You can't let it hit you. You can't let it touch you in any way. So it constantly running in a pack. You never want to be the one to stand out because you can, right? So, and for those who found that medicine wasn't for them, or maybe they didn't do well on exams, whatever, it happens, all the whispers that person faced, all of that, I just felt so bad because it was like, it was literally herd culture, herd mentality. And if it doesn't work for you, the culture didn't make space for it. I think now it's a lot better in that people are open and honest and saying, look, this isn't good for my mental health, or maybe this isn't for me, or maybe I'm going to take some time off. And we need that kind of discussion because back then it was just whispers and no one openly addressed it, which when I think back on it, I didn't stand up and say anything because the mentality was you stay in the pack. Period. It's like every man for themselves. Through it too. Yeah, definitely. And when I did my third year rotations, I realized, I was like, okay, I like some of this. I don't like that. I like some of this. I don't like that. Right. I mean, I liked pediatrics, but I didn't like the fact that it was so, like, I didn't have that hands-on care, and I didn't have them. I needed that vulnerability, right? I wanted to be there for them in spaces where they're scared. And in the exposure that I had with peds, a lot of it was well child care. So I was like, no, not that. For OB-GYN, being in that space with these new moms, but OB-GYN felt like a sorority. And I'm like, I don't like this. I didn't join a sorority. Like, I can't get down with this. And for surgery, I mean, they treat each other like crap. It was awful. So when I did explore, and I had to express that I wanted an experience on an anesthesiology rotation, that was where I was like, oh, nice. I can get a little bit of everything, and I am not in the crazy of any one thing.
Yeah.
So I could get my OB exposure and be there with those moms without having to contend with directly the sorority culture. Being yelled at for not knowing the right stitch, right? or having to hold a retractor a certain way. I can work with kids in a way that is a lot more engaging and satisfying. So anesthesiology, there wasn't a space that I saw was a con with that. I was like, I get the variety, I get the diversity, and at the time, it wasn't considered like, I mean, it wasn't as competitive as it was now. And it wasn't, I quickly knew, even in medical school, I was like, I don't want to do primary care. Because even then, it just looked like the field was not going to be, you're not adequately compensated given the degree of debt that you have to go into. And it even then wasn't respected. Like, there's a lot of discussion now about how your attendings and how your faculty members really shape your perception of different fields. And so you would hear comments all the time like, well, why would you even consider that primary care field? You're quote unquote smarter than that. Or look at these other things. And yeah, that definitely also influenced. But, again, I kind of came in already having my feelers out for anesthesia.
Yeah, and I want to highlight two things from what you said. One is that the perspectives from different institutions, it's so variable, where one place has a toxic surgical culture and another institution has a very supportive, and same with obstetrics. And it's such a disadvantage to us as students. You don't have time as a medical student to go, and I'm at Howard and I wonder what George Washington's like for obstetrics. Like, what you see is what you get, but fortunately, now with social media, maybe if there's something that you're really passionate about and your first experience isn't great, maybe you could reach out to somebody else and get some different perspective. And then I wanted to go back to your description of medical school, because it's fascinating how much that resonates with my experience. And you're just in the herd and in that pack mentality. And on top of that is the intersectionality of being a Black medical student or a Black woman medical student or a Black queer medical student. And across the board, you're probably going to struggle. And then you're trying to figure out, am I struggling more because I am X, Y, and Z? And it's just thankfully, people like yourself and others are starting to share more. So what's kind of a normal toxic experience versus an abnormal toxic experience.
Oh gosh, that's so bad, but it's so true.
Gosh. So it's like you decided on, and at what point did you decide to do two fellowships?
Right. So here now, a few things. One is that even when it comes to food, I like a little bit of everything. Okay. Mm-hmm. So when it came down to when I finally got into anesthesiology residency and that classic CA2 year, you're at the crossroads. What are you going to do? My residency program, I went to WashU St. Louis. Everybody in my class ended up doing a fellowship. Maybe one or two people decided to do private practice. And that was probably because they came in with the notion that they're going to do private practice. But the culture was very strong. Like, look, they shared with us that CRNAs are gaining more ground, more independence, and you have to stand out in a way that protects the niche that you have. And so many of us went into fellowships. And for me, I did peds anesthesia. And obviously, I liked the interaction with kids and the diversity that I got. However, I also found that I desired that longitudinal that longitudinal care outside of the perioperative period. And that's where pain came in. So then when I rotated through pain, I was like, oh, I'm getting different levels of vulnerability here, right? You get the scared person going back to the operating room, but then you also get this person who's scared of their future because they have pain and they don't know what that looks like. And how can they have the life that they want in spite of having this pain, right? And being able to walk them through that. So I realized that I love coaching through working with my patients who have pain. And I liked that hands-on experience perioperatively. So I was like, look, anesthesia fellowships, they're only a year long. That's it. It's only a year. I've invested, I don't know how many years by now. So what's the difference? What's an additional year? We could do this. And what bore out of that was me doing pediatric pain, where I am pulling from my experience teaching, pulling from my own experience with trauma in the household. A lot of our kids who have chronic pain, and many people are like, kids have chronic pain? Yeah. 1 in 5 kids have chronic pain, and the numbers are increasing. Yeah. And even that is probably underrepresented because we often don't recognize when a kid
Where's it come from?
Pain. Wow. Many different factors. One being, you can look at the autoimmune conditions, right? With rheumatology, things like JIA, juvenile inflammatory arthritis, sickle cell, for example. It's not autoimmune, but it certainly has immune dysfunction associated with it. And so you get a lot of pain and inflammation related to that. Kids who have previously survived cancer, but still have sort of this post like radiation kind of pain, pain from after having their treatments. And then a lot of what pain that we're getting in our kids is functional, meaning that we do have that body-mind connection, and the child could have been previously depressed and anxious, and something else happens in life. That could be bullying in school. They could be parents getting divorced. It could be sexual abuse. And now their whole body hurts. And that has largely a lot to do with the looking at the imbalances in the nervous system, the imbalance between the system that can amplify pain and the system that decreases pain. And it pushes the system into amplifying pain. So, chronic pain from that. And all of it involves holistic care. All of it involves developing relationship and ensuring that our patients are receiving treatment, not only with medications or injections, which injections and medications, really research doesn't find great evidence of that in kids and adolescents, but really restorative therapies, looking at cognitive therapy and physical therapy. So it's very high touch in that you have to develop a trusting relationship with your families, because they have to believe that you know what you're talking about. They have to believe that you've seen this work, because what I ask them to do is often things that might make their child's pain worse in the short term, right? Wow. But then I guarantee that we're walking this journey together. You're not going to be alone, and we're going to get through it. And we do. These kids do incredibly well. You'll never know they even had pain, ever. Because it's a complete 180-degree turnaround. They're back playing soccer. They're back doing gymnastics and doing... Well, some people decided, I don't want to do gymnastics anymore, but they're off doing whatever the hell they want to do. It's incredibly rewarding. So out of that journey came me doing that very niche area. I will say, to your point about being a Black woman throughout all of this, add on to that, for me, I was pregnant. So I met my husband when I was doing that NIH research thing. We married as I graduated medical school, got married during that time. And then my first year of residency, third year, and then my first year of pain fellowship, I was pregnant.
Oh.
So I have 3 kids. Yeah. 3 kids, 7, 9, and 11. And I was pregnant each time. So talk about being an oddball, right? I'm like in this majority white male class, Black woman and pregnant. And there was a couple other Black women in my class. But for me, when I see someone else Black, I kind of want to shoot eyes at them and be like, you see this, or this is real, or just having that moment of solidarity that you're not crazy and you're seeing this and this is really happening. But I didn't have that in my class. The other folks in there, they had their own agenda, right? They wanted to be chief. They wanted to be Smiles and I got you. And it was a very different perception. So I felt very alone in my class.
Thank you so much for joining us on the Black Doctors Podcast. If you enjoy what you hear every week, please leave us a review, leave us a comment, share with someone you know can benefit from this episode. Maybe they're interested in matching into a male-dominated specialty, which is probably most of medicine. Regardless, we appreciate your help helping the show to grow and reach more ears. So thank you for tuning in. Join us next week. We're here because representation matters.